Now, there was more hopeful news on the vaccine front this weekend as the nation races to get shots in as many people as fast as possible. And to help us understand all of this, we're going to bring in our friend, our medical expert, Dr. Arnold Baskies. He's the past chairman of the National Board of Directors of the American Cancer Society and also chair of the Global Cancer Control Advisory Council. Dr. B, good morning. If it's Sunday, it's Dr. B time.
Good morning, Stephanie.
So we want to ask you about that Johnson & Johnson vaccine because we've learned new data about it, and we've learned that, yes, it's effective against COVID-19. However, not as effective as the Pfizer and Moderna vaccines. So if the FDA goes ahead and approves the Johnson & Johnson shot, which would be 1 instead of 2 for the Pfizer and Moderna, people have an opportunity to get it. Should they say, okay, you know what, I'm going to hold out for Pfizer or Moderna, or should they just say, all right, I'll take the first shot that is offered to me?
The answer to that question, Stephanie, is a decided yes. And let me take a minute to tell you why. When the J&J vaccine headlines hit, there was some concern raised, but the Johnson & Johnson data are far better than they appear at first glance. When we break it down, the phase 3 trial of the one-shot J&J vaccine showed that it was 72% effective in the United States in preventing, and this is important, moderate to severe COVID-19. The most important part of this news is that it was 85% effective in preventing severe disease and showed complete protection against COVID-19 hospitalizations and death. This is the most important thing that the public should concentrate on. And the efficacy of the J&J product protected across age and racial groups. And the frosting on the cake showed that the efficacy against severe disease actually increased over time with no cases in the vaccinated group of patients after day number 49. The safety data is superb. It's one shot. It can be administered from a doctor's office. It doesn't require sub-zero temperatures for storage. It's more effective than a flu vaccine. Overall fever rates were only 9%. High fevers were only 0.2%. There was no anaphylaxis, and the placebo group in that study actually had more safety issues than the J&J vaccine group. The vaccinated patient's immune status increases over time. The vaccine trial shows that the patients who get the one-shot J&J vaccine don't end up in the hospital, and the shot prevents 100% of deaths in the folks who get the J&J vaccine. This doesn't sound like J&J has a problem to me.
Right, and I am glad that you highlighted that last part because that's what people are really concerned with, right? That if they get COVID, that they're going to get very sick, and that you just answered that question. And the other thing I just want to mention is that the flu shot is 67% effective, right? Yet we get that every year.
At best, it's 67% effective, yes.
Right, best case scenario. So here's the next question that we want to ask you about. New cases and COVID-19 hospitalizations dropped nationally. And the question is, what's behind that? Is that because the surge that we saw from holiday cases is waning, or is this the vaccine starting to have an impact, or is it a combination of both?
It's actually, you hit on 2 of the 3 answers to that question. The encouraging news is everywhere. COVID-19 cases and hospitalizations are dropping in almost every single state, and the rates are dropping very quickly in some of our worst hit areas. For the second week in a row, new cases and COVID-19 hospitalizations dropped nationally, 17% for new cases and 10% for hospitalizations. So the big question is why, and that's the question you asked. There are 3 explanations. First, upwards of 65% of folks, and probably closer to 85% of our citizens, are wearing masks. And there's a lot of social distancing going on, but that really doesn't account for this for a whole bunch of reasons. Number 2, the vaccines are ramping up, and we have now partially vaccinated about 7% of our population. But what I think has happened is this. We have 26 million confirmed cases of COVID, and we've seen, unfortunately, 439,000 people die with COVID. The CDC has estimated that the real number of people who have been infected with COVID is actually really 4 times that number. So if we take that 4 times 25 million, we get to about 1/3 of the population. It's amazing, having already been infected with COVID. I believe that we're witnessing the combined effect of better disease prevention and the beginning of herd immunity. So there's less COVID rattling around in the population.
Yeah, now we might actually be seeing that. I'm glad that you brought that up too. Herd immunity. Thank you. All right, Dr. Baskies, thank you so much for joining us and for sharing your insights with us this morning.
Thanks,
and stay warm.
Stephanie, and go Flyers.